pupillary reflex. In this, we will discuss about amniotic light reflex, Wernicke's amniotic pupil, efferent pathway defect, Marcus gun pupil, R.G. Robertson pupil, or Addis Tony pupil. So, coming to first topic, amniotic light reflex, there will be because of optic nerve, complete lesion of optic nerve or some retinal lesions. There will be complete blindness. Amaurosis is a Greek word which means dark or obscure. So there will be complete blindness on the affected side. If we throw light on the affected side, assuming that right side is affected, there will be loss of indirect light reflex and direct light reflex on the affected side. But on the normal side, there will be presence of direct and indirect light reflex. And the near reflex is intact in this condition. Second, we discuss about Wernicke's amniotic pupil. In this condition, there will be lesion in the optic tract here. So, if we condition is difficult to diagnose because we need a precise streak of light to falling concentrically on the left temporal or nasal half of the eyeball. So it is difficult to diagnose. In this condition, if we throw a light on the assuming that right side is affected, we throw a light on the right side. So the temporal half of the affected side and the nasal half of the normal side, light thrown on the temporal half of the affected side and nasal half of the normal side, there will be absence of ipsilateral direct light reflex and absence of contralateral consensual light reflex. But if we show light on the left side, that is normal side of the eyeball, temporal side of the left normal side or nasal side of the affected side, there will be presence of ipsilateral direct light reflex and contralateral consensual light reflex. Third, we discuss about efferent pathway defect, in which efferent pathway defect, there will be lesion in the efferent pathway which can lead to sphincter paralysis. Because of this, there will be absence of direct and indirect. There will be absence of direct and indirect reflex, but presence of direct and indirect light reflex on the normal side. These efferent pathway defect can be seen in or ophthalmoplegia and third nerve paralysis or some parasympathetic drugs with some parasympathetic drugs. Fourth, we discuss about Marcus gun pupil. In this condition, if light is shown on the right side, there will be a Marcus gun pupil, also known as relative afferent pathway defect. In this condition, there is a paradoxical reaction of the pupil in presence of relative afferent pathway defect. To detect this Marcus gun pupil, we do a test which is known as swinging light test. In this condition, if we throw light from left to right or light to left, swing the light, then there will be constrictions of pupil in the normal condition if there is no presence of Marcus gun pupil. But if we show light in affected pupil, after showing light from the normal pupil and Marcus gun syndrome pupil is present, there will be dilatation of the affected pupil and the dilatation of the normal side. This is known as Marcus gun pupil. Fifth, R.G. Robertson pupil. In this, there is presence of accommodation reaction present, but pupillary light reflex is absent. So, in this accommodation reflex is present, but pupillary light reflex is absent. Sixth is Addis Tony pupil. This is in this light reflex is absent, but accommodation reflex is near reflex is tonic and slow. So Addis Tony pupil is mainly present in young women, in unilaterally in 30% cases, It can be diagnosed by using parasympathetic drugs like atropine, pilocarpine in the clinics.